Thank you all so much for coming today to this press conference. On behalf of Smokefree Mississippi, which consists of several organizations, including the Partnership for a Healthy Mississippi, represented by yours truly, the Mississippi State Department of Health, the American Cancer Society, Cancer Action Network, the American Lung Association, the American Heart Association, the Mississippi Public Health Association, Mississippi State Medical Association, and several other organizations. Again, we'd like to thank you again for being a part of this smoke-free movement and for participating in this press conference today while you're here at the Mississippi Municipal League Annual Conference. The Mississippi Smoke-Free Coalition's focus is on providing education across the state on the harmful effects of exposure to secondhand smoke and to advocate for the adoption of strong smoke-free ordinances. According to the Surgeon General's findings, there is no safe level of exposure to secondhand smoke. In fact, he concluded that it is a serious health hazard that leads to disease and premature death in children and non-smoking adults. And so we again are happy that we're making tremendous progress on this issue. Prior to 2006, 0.01% of Mississippians were protected by law from secondhand smoke. Again, 0.01%. So we've made tremendous progress since then. Currently, we have 138 smoke-free communities as illustrated here on this wonderful map provided by Mississippi State University Social Science Research Center. And of those 138 smoke-free communities, 96 of those ordinances have language that restricts use of electronic cigarettes. So we are hopeful that every municipality on this map and elsewhere will amend and or adopt languages that again provides for those restrictions on electronic cigarette use. And even if all the municipalities in this state, which I believe is 200 plus of them, adopted a strong comprehensive smoke-free ordinance, we would not be fully protected. You know why? Because roughly 45% of our state citizens reside in rural or unincorporated areas. So we will continue our push on the state level to educate our lawmakers on the importance of having these laws in place with hopes that they will one day adopt a statewide smoke-free ordinance. But I wanted to share with you some good news. We are making some strides in that area. Recently, the county of Madison as well as Yalobusha County adopted county ordinances. And I know Yalobusha County's ordinance is a comprehensive ordinance, and prior to them adopting their ordinance, one of our honorees today, Oakland, had adopted a comprehensive ordinance. And there is, I believe, a provision within Yalobusha County's ordinance that would allow for municipalities to opt out. Well, guess what? Thus far, no one has opted out. So that ordinance provides full coverage for the county's residents. So we applaud them for that work. And then for my home county, the county of Madison, all 4 municipalities in Madison County were already smoke-free. So now all of the residents that reside in those unincorporated areas, they are now protected by law from secondhand smoke. So I just kind of want to give those counties a hand. We're so hopeful that other counties will follow their lead. And today we want to recognize some of those smoke-free communities, some of which, adopted ordinances within the last, I believe, calendar year. Mississippi, of course, is leading the nation in smoke-free ordinances as acknowledged by the Americans for Non-Smokers' Rights Foundation. We did not receive the number one award this year. However, for the past several years prior to this year, we received the number one award for adopting the most community ordinances, so we're really happy with that. But again, we want to recognize some of the smoke-free champions across the state, one of which is Mayor Gene McGee of Ridgeland. Mayor McGee was one of the early pioneers in the smoke-free movement. The city of Ridgeland adopted a comprehensive ordinance in 2007, which at the time protected 6.14%, I believe, Robert, of the state's citizens from, again, the harmful effects of secondhand smoke. So you can see that we've come a long way. Again, right now we have 138 smoke-free communities, but that only covers about 32% of our population. Again, so we are making tremendous stride in that area, but we still have a long way to go, again, as demonstrated here on this map. But like I said, Mayor McGee was one of the early pioneers in the movement. The city of Ridgeland has made significant strides in creating a culture of health and wellness for its residents, businesses, and visitors. In 2013, the city of Ridgeland earned the distinction and the honor of being Mississippi's healthiest hometown. I believe that award was presented to Mayor McGee by the Mississippi Blue Cross Blue Shield Foundation. Ridgeland's efforts were spearheaded by partnerships among schools, among civic organizations, among businesses and faith-based communities, as well as local government officials. Through Ridgeland's Healthy Hometown Committee, every facet of the city is united on creating a healthier environment and promoting healthy behaviors among its residents, including encouraging people to adopt healthy lifestyles, exercise regularly, tobacco prevention, tobacco cessation, and eating healthy and nutritious foods. Ridgeland is also the home to nearly, I believe, 15 miles of recreational trails, which gives Ridgeland the distinction to have the most trail mileage of any city in the state. So I think that we owe them an applause for that. And certainly at the helm of all of this progress is Mayor Gene McGee. The mayor has provided exemplary leadership and has provided a model for other municipalities to follow. So without further ado, I would like to introduce Mayor Gene McGee.
Thank you, and obviously, thank you all for what you all do to support our municipalities and to attempt to make things better for our citizens and our guests that come into our cities so that they can have a better lifestyle, a healthier life. And we believe in Ridgeland that a healthy lifestyle is what makes quality of life, whether it's the smoking, non-smoking, or non-tobacco, not just smoking, but tobacco, but also other things such as eating healthy and all those things that are so important. I want to go back to when we were working on our non-smoking ordinance in public places, and if you know much about Ridgeland, we have a lot of restaurants. We have a lot of hotels. And so we had a lot of smoking in restaurants and hotels and also some bars. And so there was a lot of people who thought that once we did this ordinance, that it was going to put them out of business. It was just absolutely, they just couldn't stand the fact that we were going to adopt an ordinance that was not going to allow people to smoke in their restaurants, their bars, and the majority of their hotels. Interesting enough, two of our leading restaurants, one of them Tico Steakhouse, which is a favorite hangout place of legislatures, and Fortisa's Italian restaurant, The owners of both of those particular restaurants, Tico and Pam Patisi, on the sly called me and said, look, we can't support what you're doing because we don't want to offend our customers, but we want you to pass it. We're very interested in getting rid of the smoke and all of that. Had another situation that we have a nightclub out near the reservoir called Shuckers, and a lot of smoking and that sort of thing. So one of the aldermen from Morton used to go there quite frequently to dance and all those kind of things, have a good time. And she told me, she said, I would always leave Shuckers on Saturday night going home back to Morton with some terrible headache. Wake up on Sunday morning feeling awful. But now that you've done away with the tobacco, the smoking, everything at the restaurant, at that bar, you know, I can go there, have a good time. I'm not in all that smoke and everything. It's a great thing. So it's been good. And I can tell you that the businesses in Ridgeland have not been hurt. The restaurants, we've seen situations where restaurants were hurting because families would not carry their families there, their children, because they didn't want to be exposed to secondhand smoke. But now, since we've done that, it's a family atmosphere. There's no smoking in the restaurants. And we also have that limit of 20 feet from all ventilation indoors. And by the way, we tried that. We were sued, and we tried that all the way in the federal court. It took over 5 years for the judge to rule, but we won that case where that if you smoke, you can't smoke within the 20 feet of the door or 20 feet of the ventilation system. So it's become a very positive thing. Every day I hear from folks telling me it's helped them quit using tobacco, and the fact that they're again able to enjoy going into a restaurant, having a good meal, and the smell of the food is the good thing, and not smell of tobacco products. Now, for me, it was mentioned that we believe in health. I've gone vegan, which means I don't eat meat either. And I've done that for over a year. But we believe that we can promote good health. We can promote where that we can reduce obesity. We can reduce that those people that are dying from cancer, that all those problems that occur. By setting an example of a healthy lifestyle and providing a venue for a healthy lifestyle. Our goal in Ridgeland is to have a multi-use trail that every citizen can access safely and either jog, walk, cycle, anything like that. I was talking a while ago, we have a 100-acre mountain bike trail that's actually not in our city, but we own it, where the people get out and ride mountain bikes. And so we encourage that every construction project that we do in Ridgeland, a new road or an expansion of a older road, we require that a multi-use trail be put on it. So we're wanting to promote good health. I want to congratulate the cities that are qualified and have done their ordinances. We really need to get behind our organization and promote getting this statewide. One of these days I'd like to see that I'm not walking out of the Coliseum or walking out of other places and seeing people gathered by different places and smoking. I think that would be a wonderful thing that would be smoke-free. Thank you, and God bless, and good luck to you.
Thank you, Mayor McGee. My name is Tiffany Johnson. I'm here representing the Mississippi State Department of Health and also representing the Mississippi Tobacco Free Coalition. I hope in all of your efforts to pass smoke-free ordinances that you had the opportunity of working with your local Mississippi Tobacco Free coalitions. The Office of Tobacco Control, State Department of Health fund these coalitions throughout the state of Mississippi, which we have a total of 34 coalition directors that serves all 82 counties, and we have the pleasure of having them because they're able to go out and provide this day-to-day education to each of you and help provide that support as you are trying to make the decision of if you're going to pass an ordinance and making sure that it's comprehensive, and we're trying to protect as many citizens as we possibly can. So I would just like to say, thank you all for all of your hard work and your dedication that you've put forth in this effort. If you have a next door neighbor, city that currently does not have a smoke-free ordinance, I ask you to call upon them to join in this challenge with you and becoming 100%, passing 100% comprehensive ordinance. And at this time, I would like to bring one of our partners to the table who's going to do closing remarks as well as provide the awards to the city. And that's Dr. Robert McMillan. He's with the Mississippi State University Social Science Research Group.
Thank you, Tiffany. As Tiffany said, I work at the Social Science Research Center at Mississippi State University, and my staff and I, who are hiding in the back, provide surveillance and evaluation services for the Office of Tobacco Control. And in that role, we do a lot of analysis looking at issues related to tobacco, but we also closely monitor the progress of smoke-free ordinances at the local and county, municipal and county level. We also look at the health impacts of these ordinances, the economic impacts of these ordinances, and the effects on tobacco use. And the news is all really good when we look at this. As we've said before, we have 138 municipalities protecting 32.12% of our population from secondhand smoke with 100% comprehensive ordinances. We passed implemented 15 more this year to bring us to a total of 138. And there's widespread public support for this. We do a social climate survey of Mississippi adults each year. And for the last several years, about 3/4 of adults have supported a statewide comprehensive law. And that's 3/4 of Republicans, 3/4 of Democrats, and 3/4 overall. This is not a partisan issue. There's not a lot of public resistance to having local or state level elimination of exposure to secondhand smoke in public places. We've also looked at the role of what do smoke-free ordinances do to smoking behaviors. Mayor McGee touched on this earlier, but it helps to prevent tobacco use. One of the main things it does is prevent adolescents from becoming smokers, because when they're out and about, they're much less likely to be curious and take a first cigarette from somebody if they have to go step outside in 100-degree August weather or step outside in 25-degree cold weather. If they can't just smoke it at the bar, they're less likely to accept that first cigarette. Also, it serves to denormalize smoking. If a smoker has to go outside by the loading dock or by the dumpster to smoke a cigarette, that's going to send a message that maybe this is not what normal people do. And on top of that, it's just the inconvenience of not being able to smoke throughout their work day or their shift at a restaurant motivates smokers to try to quit. So when we have local smoke-free ordinances, we see that fewer adults smoke, more of them try to quit, and fewer adolescents begin to become smokers. We also see that this does not hurt local economies. Again, as Mayor McGee said, initially, when communities go smoke-free or consider it, there's a lot of concern that it's going to hurt the hospitality industry. The bars are going to suffer. But what the restaurant owners don't notice or don't know when this comes up, they look out and they say, well, every time I look out on my floor, 1/3 of the people are smoking. So that's because your non-smokers are staying at home because they don't want to come into a smoking environment. So what happens in these communities is initially the smokers may stay home, but where else are they going to go? I mean, they're not going. People say, well, I'll go to the next county over. They're not going to drive to the next county over just so they can smoke a cigarette. They pretty quickly learn to step outside or they quit. And the non-smokers come out more often and they stay for a second drink or a cup of coffee because the smoke's not bothering them. And we looked at the hospitality revenue from many municipalities. Mississippi allows a municipality to charge an optional 2 or 1% tax on hotels and or restaurants and put that into tourism and economic development. We can monitor that through state records. And on average, we actually see an increase, modest increase, but an increase in revenue after communities pass smoke-free ordinances. So it certainly didn't hurt the communities, and some of them it seems to maybe even helped them a little bit. So this is a win for public health, and it's a win for local economies, and it's just a win all around. And I'm really excited to announce the awards for the next 15 communities that bring us to a total of 138 municipalities. And the first one I'd like to, I'm doing these in the order in which you passed the ordinances. So the first municipality I would like to commend is the municipality of Shaw. So if you are an elected official from Shaw, please come up and receive an award from Tiffany. Thank you. Good job. And the next municipality is the municipality of Chula. If a municipality is not here, we will send the award via the coalition leader to them. The next municipality is the municipality of Houston. And I'd like to add another reason to commend Houston, going back to Mayor McGee's comments on multi-use path. There's a wonderful multi-use path that now runs from Houston to New Albany. I've ridden on it. I think it's a really nice addition to Houston. Woodland. There we go.
We got their picture over there, and then, got it? Then we're gonna get this, or what?
Okay, and our next municipality is Edwards. Okay, and our next municipality is Oakland. Yeah.
I got two more.
I'm like most of the people in this room and most of the people that will be attending this press conference today has a personal story as it relates to the ravages of tobacco use. My father is a long-term smoker, and he has suffered with lung disease and a number of other illnesses as it relates to, his prolonged use of tobacco, unfortunately. But as an advocate for tobacco-free lifestyles, I've witnessed the progress that we've made over the past several years in Mississippi in reducing the number of youth that are starting to smoke, and in expanding our footprint as it relates to communities that adopt tobacco-free ordinances or smoke-free ordinances.
What are the trends among young people using tobacco and the efforts by the tobacco companies to encourage this?
Well, of course, when we started the movement many decades ago, I believe that our youth high school smoking rate was hovering around 33%. Now it's down to roughly 9.2%, which is attributed to all the work that has been done in terms of educating the public on the harmful effects of smoking. Education that has been provided by the Mississippi State Department of Health through the community coalitions across the state. They're the vehicles that go out into the communities, into schools and churches and businesses, and talk about, the harmful, again, effects of smoking, as well as the harmful effects of exposure to secondhand smoke. So I would attribute it to the education that has been provided, as well as a number of the ordinances that have been put in place across the state to restrict smoking in public places, particularly workplaces, again, because we want to protect workers and patrons and visitors, again, from those harmful carcinogens that are known to cause cancer and other diseases in non-smoking adults.
If people have questions, first of all, your reaction to everything that you've seen or heard here today regarding this issue.
Well, it's been pretty positive. Again, I think before the movement started, the smoke-free movement started, I don't know that people were fully aware of what those effects are with, again, the exposure of secondhand smoke. And I think now that people are properly educated on the issue, people are making better decisions for themselves and for their families in terms of, limiting their exposure to smoking environments.
I'm here representing the agency, the Mississippi State Department of Health, and to award cities who have passed comprehensive smoke-free ordinance for the last fiscal year with the support of our community-based coalitions that we fund through the Mississippi State Department of Health.
What is the trend when it comes to municipalities moving to be smoke-free?
Well, what we found lately is that a lot of local ordinances are moving along pretty quickly with the cities actually implementing these policies. Before it started off, before we actually got all of our coalitions, and we have 34 Mississippi tobacco-free coalitions that are stationed all across all 82 counties within the state of Mississippi. And once we got all of those individuals in place and got them trained, they was able to go out and really work with these local municipalities and provide them with education and resources on the benefits of living in the benefits of having a smoke-free environment. And from there, we've seen a massive numbers of local policies being passed.
How did you get involved in the issue of smoke-free?
Where how I got involved, I've been involved with public health for about 15 years now, and we're working with the Department of Health. I made the transition into tobacco control, and from there I worked to develop our coalition, so it has been a passion of mine for the last 7 to 8 years.
Do you have any personal involvement or personal history with the issue of tobacco use?
Yes, I do. Unfortunately, I had 2 uncles who passed away due to smoking-related diseases.
If people have questions like more information about Smoke-Free Mississippi, what should they do?
What they should do is they should most definitely reach out to the Mississippi State Department of Health. That can be done via the website. If not the website, they can contact the Office of Tobacco Control at 601-991-6050.
They should contact the Mississippi State Department of Health or organizations like ours, the Partnership for a Healthy Mississippi, as well as the Social Science Research Center at Mississippi State University. We all have websites. If you Google us, you can find us. There are a number of other organizations that are involved. The American Cancer Society, Cancer Action Network, the American Lung Association, American Heart Association, and others that, again, are a part of this movement and are part of the progress that we've made in this state.